Hi, I'm Dr. I'm Dr. Seema Sahay. My good afternoon to all of you, and also I wish you very happy Dashera. You must have enjoyed Vijayadashmi and all your Navaratri festival. Gravidarum is one of the type of this uh, symptom that is called morning sickness. So, first, I'd like to give you some brief idea about this topic. That morning sickness is very common, and this is nothing but the vomiting during pregnancy, which every woman, almost 90%, 80 to 90%, experience during their pregnancy and during the first 3 months. I mean to say during the first trimester. It's a very common thing and very natural thing. We call it morning sickness, feeling of nausea, vomiting, and altered taste, and doesn't want to take food and like that. But the topic which I'm going to talk with you today is hyperemesis gravidarum. It's a little bit different from morning sickness or vomiting during pregnancy. Hyperemesis gravidarum is a condition when the vomiting becomes excessive, so much so that it affects her daily activities, her daily routine, and affects her health also. Health means there is a dehydration, there is fluid electrolyte imbalance, and loss of weight. You can say that patient becomes ill, and this condition is called hyperemesis gravidarum. When the vomiting is excessive, she becomes very much disturbed. Her daily life is affected, and always feel dehydrated. Symptoms of dehydrations are there, like irritation and letharginess and everything like that. And morning sickness is a very simple thing. This is the morning sickness which every woman experiences in the first trimester of pregnancy. Is just feeling of nausea, vomiting, which starts very early, around 4 to 7 weeks of pregnancy, and it is a self-limiting condition. It disappears of its own when the pregnancy reaches 12 to 14 weeks, and latest by 20 weeks, not more than that. In very few patients, it can continue up to the whole pregnancy, but not usual. And it disappears, self-limiting condition. This is called morning sickness. But when this morning sickness becomes excessive, patient vomits so many times, becomes dehydrated and very much lethargic. She cannot carry on her daily activities, and she needs hospitalization. She's not big, and she's not improving by the simple treatment. This is called hyperemesis gravidarum. Hyperemesis means excessive vomiting. It is a little bit different condition from morning sickness, which I wanted to explain you. So when it becomes hyperemesis, now the treatment also becomes different. In morning sickness, we just simply assure the patient, give her emotional support, and we give advice about their diet, that avoid free and fatty meals, take plenty of fluids, take carbohydrates, and just small and frequent meals. Don't take heavy meals at one time. Walk after a meal. Do not lie down immediately after meal. And these simple measures help the patients a lot. She becomes all right, and she's okay with these treatments. But when the vomiting is also excessive, and by these simple treatments, antiemetics, reassurance, and dietary changes, and all that, then we interfere. Now, patient is not okay with this treatment. Sometimes we need hospitalization. And simple, we do three things: correct her electrolyte imbalance. Sometimes we have to withhold nutrition orally. We have to give it by IV fluids and all that. Sometimes by Ryle's tube. We have to give injectable antiemetics, vitamin supplements, which also becomes necessary if the vomiting is excessive, and regularly check her urine and electrolytes and her general conditions, monitoring like pulse, blood pressure, urinary output, everything. And we have to go step by step. First, we generally give antiemetics. Then, if the patient does not improve, then we start parenteral nutrition. If also patient does not improve, then we go for other measures also. And usually it helps. Patient becomes all right, and hyperemesis also disappears uh, after first 3 months, latest by 4 or 4.5 months. But sometimes it so happens that hyperemesis is associated with some disorders. Like sometimes it is associated with medical disorders like high blood pressure, some renal problems, diabetes, and there are other things also. Sometimes with surgical disorders like acute appendicitis, cholecystitis, and there are so many infections, intestinal obstruction, even worm infestation can lead to excessive vomiting. And sometimes it is associated with particularly pregnancy disorders like hypertensive disorders in pregnancy. There is one condition which is known as molar pregnancy or trophoblastic diseases. These are also associated with hyperemesis, and a very simple condition that is multiple pregnancy. Twin pregnancy is also associated with excessive vomiting. Obesity, even obese patient can have excessive vomiting, and improper diet can also lead to excessive vomiting. And there are some surgical conditions. Surgical conditions means there is a ovarian cyst which becomes which goes under torsion. This can also lead to excessive vomiting. And there are so many causes. Sometimes medical disorders, surgical disorders, pregnancy related disorders, but most of the cases it is physiological. There's no cause behind it. And if there's and the causes are also very simple, like in first pregnancy, neurogenic, very disturbed patients, or very anxious patients, very stressed patients. So these causes are treatable. So whatever be the cause of hyperemesis, uh, all the causes are almost treatable, and the patient improves. If improvement rate is very good. So I want to explain you the thing between the morning sickness, the difference between morning sickness and hyperemesis. Morning sickness is a very simple thing, excessive vomiting, and just by simple assurance and dietary measures and antiemetics, patient improves. And 80 to 90% suffers from morning sickness. I think you must have understood what is the difference between hyperemesis and morning sickness. Now, I'll go with your questions. I would be happy to interact with you. You can ask anything about hyperemesis. Hello. Yes. It has been answered. So yes. Uh, Now I'm going to answer the video. So first I would explain you known as human by the placenta and the chorions and the excessive hyperchorionic gonadotrophin. This is one of the hormone which leads to hyperemesis. Second is the most common female hormone, as you know, is estrogen. Estrogen excessiveness, which is normal in pregnancy, this also leads to hyperemesis. Third hormonal cause is hyperthyroidism. So we must check thyroid hormones when the patient is complaining of excessive vomiting. So hyperthyroidism is one of the very important cause of hyperemesis gravidarum. And there are so many medical disorders, as I explained you right now. For example, if the patient is having some renal problem, she may have liver problems, then maybe diabetics, twin pregnancies, Down syndrome, improper dietary habits. These are the very common causes of hyperemesis. Then symptoms that patient frequency of vomiting is very high. She may vomit 10, 8, 10 times during 24 hours. She is not able to take that properly. Gradually, she becomes dehydrated. She'll complain you excessive lethargic, loss of appetite, and doesn't want to work, doesn't want to go outside, does not want to carry her daily activities. She will also complain that her urine output is very low, and sometimes we experience acetone breath, and that is a peculiar smell in her during her when she breathes. So these are the common symptoms: loss of elasticity of the skin, and that. These are the common symptoms and causes of hyperemesis. Uh, Varsha is asking, is there a cure of hyperemesis gravidarum? Yes, sure. I don't. I till now I have not found any patient who has not been cured by the treatment. Of course, the treatment is a little bit different from simple morning sickness, but the patient gets cured. We have to admit her and then start parenteral nutrition. Oral nutrition is withheld for 24 hours. We give nutritional supplements like vitamin. And I should say one thing that vitamin B1, B6, vitamin C is very important. We give her bland diet, solid bland diet, and sometimes rice tube feeding is also needed, and simple antiemetics like prochlorperazine and promethazine, ondansetron, metachlorpromide, and I would also like to uh, explain these drugs like metachlorpromide, as you know, Perino. It's a very good antiemetic, but which works in hyperemesis. It speeds up the gastric emptying. Then a very first drug of choice is doxylamine, which is antihistaminic. As you know, doxinate, vitamin B6, pyridoxine. These are the simple antiemetics which we try first with, and other things are we monitor the patient regularly, checking her electrolytes, her urinary output, And pulse, blood pressure, fetal condition, the signs of dehydrations, everything we monitor very frequently, and the patient improves. Yes. Uh, Varsha is asking, how does hyperemesis gravidarum affect pregnancy? Uh, it can affect pregnancy by affecting the fetus and affecting the mother both. As I told you, the dehydration will affect the patient, and the weight loss, and these things are going to affect the mother, and fetus is also affected. Fetus may be low weight, low birth weight, preterm labor, like this. These are the simple effects which can happen to mother and fetus both. Uh, Navlat Kapoor is asking, how can one avoid this through diet? Yes, diet is a simplest thing which you can change, and definitely the vomiting improves. By that, we ask the patient to avoid spicy and fatty foods, because fatty and spicy foods triggers vomiting, and it can also cause hyperacidity and burning and all that. So we advise bland diet and plenty of liquid, fruit juices, etc. But during hyperemesis, we have to sometimes we have to withhold the diet also. So the diet has got very important role during this hyperemesis period. Lakshmi Mishra is asking, is hyperemesis gravidarum considered a disability? No, never. It's not a disability. It's a condition, sometimes with cause, sometimes without cause. You treat the cause and the patient improves. So it's not a disability, not at all. Lakshmi Mishra is also asking, what should I eat if I have hyperemesis? Just now I explained, you take plenty of fluids in the form of plain water, fruit juice, and you take small and frequent meals. Do not take heavy meals at one time. Avoid fatty foods, spicy oil and ghee much. Mostly you go for fruits, fruit juices, and these things will definitely improve your condition if you have hyperemesis. But if if you are not able to take these things, even these things, then you must consult your doctor, get admitted, and by just treatment, you will improve and nothing will happen. Next question from Lakshmi Mishra is, who is at higher risk of hyperemesis gravidarum? Uh, Hyperemesis gravidarum, yes, there are certain high risk factors which are associated with hyperemesis gravidarum. Uh, Sometimes medical disorders like diabetes with pregnancy, renal disease with pregnancy, hyperthyroidism, very common conditions, urinary tract infection in pregnancy, uh, Down syndrome, multiple pregnancy, excessive fat. Usually, sometimes it happens in first pregnancy also. Very stressed patients. I mean, neurogenic cause. Uh, Stress may be anything. Maybe she's a working woman and she has got stress in office or like that. So, and sometimes surgical conditions also, like acute appendicitis, acute cholecystitis, gallstones, uh, like that. Sometimes intestinal obstruction. Even a simple condition, as I told you before, worm infestation can also lead to hyperemesis. And then surgical conditions, pregnancy related conditions, which is very common. We call it eclampsia and preeclampsia, hypertensive disorders of pregnancy, and offsetting causes. As I told you before, molar pregnancy, there's a one condition, placental trophoblastic tumors, it is called. So these patients are at high risk for hyperemesis gravidarum. Our next question is from Nikita Suraj Rathor. मेरा बच्चा 1.5 महीने का हो गया है, उसका आज दूसरों का है, वह बहुत रो रहा है, उसका उपाय बताइए. I couldn't get your question, Nikita. Can you? अगर बच्चा बहुत रो रहा है तो बच्चे को हो सकता है कोई डिस्कम्फर्ट हो, सिंपल कॉलिक हो. बच्चे तो सबसे ज्यादा रोते हैं कॉलिक के वजह से. सो उसे बार्पिंग कराइए, उसका देखिए स्टूल का कंडीशन क्या है, यूरिनेशन अच्छे से हो रहा है कि नहीं, या किसी तरह के वो डिस्कम्फर्ट में तो नहीं है. कभी कभी बच्चे बच्चे जो है सो क्लोथ्स के वजह से भी, एक्सेसिव ठंड से भी, एक्सेसिव गर्मी से भी, देर आर सो मेनी this way, but the commonest is colic. So you must go to pediatrician and ask and just take simple measures at home. And if it doesn't improve, then you can consult pediatrician. Revti Rajmani has asked, what causes morning sickness in pregnancy? The morning sickness in pregnancy is a very common disorder, very common problem. Almost, as I told you, 70 to 80% women suffers from morning sickness. Usually, it starts during 4 to 7 weeks of pregnancy, and it is a self-limiting condition. Self just disappears of its own when the pregnancy reaches the second trimester. Maximum it can go up to 20 weeks, not more than that. And cause of morning sickness is also hormonal. That is human chorionic gonadotrophin, estrogen, thyroids, and then simple things like that during her first pregnancy, neurogenic stress, Down syndrome, obesity, multiple pregnancy. These are the simple things which can lead to morning sickness. But morning sickness is a very simple condition. It is treatable, and just simple reassurance, fluid, and uh, avoid fatty diets, it will improve. Madhvi is asking that is it true that morning sickness is a sign of healthy pregnancy? No, there's nothing like that morning sickness occurs in healthy pregnancy. But morning sickness is a natural sign of pregnancy. It doesn't mean that pregnancy there is some disease that the patient is having morning sickness. It is a simple symptom of pregnancy. But healthy pregnancy is a different thing. Morning sickness can occur also in those conditions when there is something lying in behind it. So it's a very natural condition. Durga Salvi is asking, how long does hyperemesis gravidarum last for? Hyperemesis also, just like morning sickness, you have to treat it, and after treatment, it improves, and maximum it can go up to 5 months, 20 weeks, not more than that. And if there is cause associated with it, you have to remove that cause. Otherwise, it will continue unless you remove it. Next question is from Bhavna Anankat. How can I stop morning sickness in early pregnancy? Just you, uh, just you get up early and just walk, do some breathing exercises, and you can take antiemetic, which usually we give at bedtime, like doxylamine, which is antihistaminic, and take just plenty of fluids, avoiding fat-free diets, uh, and small and frequent meals. It will stop. Hi, Rajnish Srivastav. Yes, what do you want to know? What precautions one should if the patient is diabetic? If the patient is diabetic, the treatment starts not after she conceives, but treatment starts before she conceives. Pregnancy should occur when the blood sugar is normal, because diabetic and hyperglycemia is one of the important cause of hyperemesis. So you must control the blood sugar. As I told you earlier, that you have to remove the cause also. When the hyperemesis is associated with some medical disorder, so you have to check your blood sugar, and then, of course, the simple treatment and the normal blood sugar. This will improve your condition. You have to treat your diabetes first. I want to thank you so much, audience. I want to tell you my referral code. This is SEES, 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 and I hope that I have satisfied your questions. So thank you very much for listening me so patiently.